Times.
18, I'm Ridhima Bhatnagar. Lots happening here on a Sunday. So let's begin with some breaking developments that we're getting in. The NCB takes comedian Bharti Singh and her husband into a Mumbai CMM court. We're understanding that the NCB Special Public Prosecutor says that the NCB, of course, will be seeking a 7-day judicial custody for Bharti Singh and a 7-day NCB custody for our husband as well. Of course, remember, since morning we've been giving you developments that after questioning yesterday, Bharti and her husband were arrested. They, of course, accepted to consumption of drugs, 86 grams of ganja. Understanding seizures were also made from the raids that happened in their residence yesterday. All of this after a peddler was arrested. Now, remember, the NCB has been conducting parallel developments as far as this drug cartel in Bollywood is concerned.
आज हम लोग पीसी मांग रहे हैं, बस इतना ही हमारा है। नहीं,
भारती और हर्ष पे क्या चार्जेस लगाए हैं?
भारती के ऊपर कंजम्पशन के चार्जेस है और उसके हस्बैंड के ऊपर फाइनेंसिंग भी है। तो दैट्स व्हाई वी आर आस्किंग कोई यानी बाकी ड्रग डीलर के साथ, पेडलर के साथ उनके कनेक्शंस है। दैट वी आर ट्राइंग।
क्या हर्ष सप्लाई करते थे ड्रग्स?
दैट आई कांट से राइट नाउ।
Going across to my colleague Harman, of course, who has been tracking all these updates. So, of course, Harman, now we're understanding that the NCB will be seeking a 7-day custody. There are different charges for both Bharti for consumption and the husband who could be in a nexus of peddlers.
Well, Ridhima, yes, good afternoon. In fact, the media has not been allowed to enter the court here at the magistrate's court. But yes, what the special PP there has been saying, as my colleague Mihir has been pointing out, is that the charges have definitely different. And this definitely spells a lot of trouble for her husband particularly, because it is 27A of the NDPS Act. What does that mean? Well, while on Bharti on her hand has been charged as far as the consumption of drugs is concerned, her husband is, the charge against him is far more serious, because that is about the financing of the drug cartel. Now, if convicted, he can get a minimum sentence in jail is 10 years, but then it can go up till 20 years as deemed fit by the judge, who then will hear the case as and when it comes forth. Also, at the same time, it also carries the fine of nothing less of 10 lakhs, but that again can be extended to a maximum of 20 lakhs. This is a very serious charge.
Yeah.
And in the last time we've seen, whenever drug peddlers have been arrested, or any other actors, in certain cases seizures were never made. Like, for example, Riya Chakravarti, when she was arrested too, there were no contrabands that were seized. But in this particular case, there has been ganja. Yesterday, one was wondering as to why there was a lot of time that was being taken for her husband's arrest to be pronounced by the NCB, because later in the evening is when it was informed that Bharti Singh was arrested. But there was quite some time, and it was only, in fact, this morning that the NCB confirmed the husband's arrest. The reason, what I'm told by my officers, by some of my sources within the NCB, is that they have believed that he's part of a larger drug network. He was involved in the procurement and selling of drugs, and that could spell trouble, because as far as Bharti Singh is concerned, that's personal consumption, but her husband has been procuring this drugs, selling it to others. And as one was saying, as you in the last bulletin, as you were asking, this is looking at a larger nexus here. But as I was, but right from the start, what, Ridhima, there's no big fish, from where exactly are these drugs. The source point is yet to be known by the NCB, or any of arrest of some big fish is yet to be carried out by the narcotics
Harman,
control.
exactly the thing that we've been discussing, for the last couple of weeks, ever since the NCB started with this wider investigation into Bollywood's drug cartel, which of course started with the Bollywood biggies, but has now gone on to the television actors as well. All of this while for them trying to establish a larger nexus, because the NCB for the longest time, even when they started the questioning with Deepika Padukone, then to Arjun Rampal and some others, is that there is a larger nexus at play. There are actors who are involved not just in consumption for personal use, but also in terms of procuring and selling these drugs. And these are the same charges that we're looking at Bharti's husband as well. And that is why this could spell bigger trouble for the husband.
Absolutely. In fact, Ridhima, right from the start, the NCP believed that it was not just always the drug peddlers who were selling drugs. There were several people within the industry. This was, in fact, a news point some weeks ago when they said that there were several TV actors who were also involved in the selling of drugs. at that point, no names were given out clearly, but today that news break is definitely confirmed with the arrest and this sort of allegation coming in from the NCB saying that he has been booked under 27A, that is the husband of Bharti Singh, that he was involved in the financial dealings of the very drugs. Now, he also owns he himself has appeared in some shows with her, but they also own a production house where it is believed that several TV actors also were part of. Now, whether it was, say, for example, in the case of Con, the talent management company, where Deepika has also been part of, that was under the scanner, is also the production company of Bharti Singh also involved in some sort of similar drug networks. That is something that the NCB would want to try and to establish, which is why they would seek a 7-day custody for him to and one can expect, in case if the 7 days are given to him, that surprise raids, far more actors, a lot of producers' names could also crop up, is what NCB has been telling us.
Absolutely, Harman. So, of course, this doesn't end here. We're expecting more summons to be sent out to more actors as well. But as of now, trouble, of course, for the comedian couple, where the NCB is now seeking custody of both Bharti and her husband. Shifting focus to some other stories then, with the central government now allowing postgraduate scholars of Ayurveda to formally practice general surgery, including ortho as well as dentistry, the Indian Medical Association of the IMA has now strongly condemned this move by the Central Council of Indian Medicine. This is the body which regulates the medical study and practice of Ayurveda in the country. The IMA has stated that it saw this move as a retrograde step of mixing the systems, which it said will be resisted at all costs. It also urged the CCIM to develop its own surgical disciplines from its own ancient texts and not claim the surgical disciplines of modern medicine as its own. In a Gazette notification dated 20th November, the CCIM amended the Indian Medicine Central Council Regulations 2016 to introduce formal training and practice in surgeries to the PG students of Ayurveda. Right, let me first go across to Rajiv Vasudevan, MD and CEO of Ayurveda Hospitals. Doctor, good afternoon. Let me first understand your perspective. Of course, the IMA is very, very cross with these developments that have happened. They're saying that at no cost will they allow the modern as well as the traditional set of practices to be mixed, because they feel that the Ayurveda doctors are not capable to handle modern surgery. How do you feel about this?
Well, I think it's a very, very knee-jerk reaction coming from the IMA. They should first of all study the details of the Gazette notification. It's very precise in terms of who can do what. The concept of privileging of Ayurveda doctors, right, is very much enshrined in the way the postgraduate system of education is defined. There is a 5.5-year undergraduate program, very much similar to what happens in modern medicine, followed by a 3-year postgraduate program, and which has active access and practice on patients. It's very legal. It's been going on for 25 years. The two specialties under which surgery has been permitted is Shalya Karma, which is Ayurveda parasurgery, general surgery, as per classical terms. And number 2, Shalakya Karma, which is eyes, ENT, and everything above the clavicle. So basically neurological. But to say that this is giving license to Ayurveda doctors to do everything under the sun what modern medicine does, I don't think that is the intent of the Gazette notification. It's very precise in what Ayurveda doctors can do and not do. And at this point, let me also stress one very simple thing. Many of the things that modern medicine doctors do use today, right? Even the surgical instruments are attributed to the Shushruta Samhita, which goes back to 600 BC. The father of surgery globally is acknowledged universally as Shushruta, Acharya Shushruta. So we should not run away from, in a turf war. We should not try to just build walls. Instead of that, I would urge the IMA to responsibly to come and discuss with the Ayurveda experts and try to understand how is it that Ayurveda intends to practice.
Right. I think that's a very mature approach to what you're suggesting, Dr. Vasudevan, which is that try and get to a middle ground where both Ayurveda as well as the IMA or the modern doctors can work together. But the IMA has been very, very, categorical in what their stand will be. They're saying that they will, of course, continue to have their protests against this move by the government because they feel that lakhs of patients' health will be at risk simply because that Ayurveda Ayurveda doctors haven't been involved in modern surgeries like the doctors from the IMA or so on and so forth really have been. Do you agree to the fact that the lack of practice by these Ayurveda doctors could probably need more time for them? So it would actually be better if they start assisting some of the doctors, say from the IMA first, and then go on to surgery themselves.
As let me repeat, at the risk of repeating myself, let me say that what Ayurveda doctors have been doing for the CCIM president, Dr. Dev Pujari, has very clearly stated that what is being done today is to formalize and legalize what has been in practice and in vogue for the last 25 years, formally, right, under the CCM Act. It's just being ensured so that the concept of credentialing and privileging, which is as per NABH standards, to ensure that somebody who's legitimately allowed to do the procedure only is doing that. Nobody is telling that anybody can do everything.
Okay.
Here, the CCIM very responsibly has told they will train people very formally going forward to ensure that those procedures they are legally allowed to do. I don't see anything wrong in that. The only point that the IMA should be concerned about is what are the boundaries? I don't think it's a question of mixopathy. This is a grave mistake being done. It is not that Ayurveda doctors are sitting and doing everything that modern medicine does. It is really about doing what Ayurveda doctors can very well do. For example, the procedure called Chara Sutra.
Okay.
Right? It has been subsumed into modern medicine. It's been there from ancient times.
Okay.
Today, for anorectal conditions, it is called a set-on thread therapy. It's approved in the UK formally. It is used by most of the modern anorectal surgeons.
Your perspective is that, of course, Ayurveda doctors are well qualified, and if a middle ground can be reached between both sets of doctors rather than going to war, that will actually work well as far as the medical fraternity is concerned. Dr. Rajiv Devan, I'll leave the conversation there, but let me also bring in Dr. Vinay Agarwal, who's also the former president of the IMA. Dr. Agarwal, if you heard this conversation that I was having as part of the Ayurvedic perspective is concerned, they're saying that there is nothing that they can't really do and they're equally qualified. But the IMA stand has been mixopathy, which is don't mix a modern as well as traditional practice, because both require a very different set of skill sets.
See, I am surprised with the statement of Dr. Vasudevan. I mean, he's a very senior Ayurvedic practitioner, and he's saying that whatsoever has been happening for last 25 years, it is an issue of legalizing that. Now, I'm surprised that Ayurvedic doctors who are trained in Ayurveda, on one side, we should make advancement in Ayurveda. On the other side, we should make Ayurveda to reach to everyone, not to encroach upon other specialties. You just imagine, MBBS takes 5.5 years, 3 years surgical this thing, and after senior residency. A proper surgeon who can perform a skillful surgery takes about 9 to 10 years of training to become that. And what are they proposing? In this Central Council of Indian Medicine has proposed that after 3 years of training, they can take surgical training and they can perform surgical operations.
Okay.
Which surgical operations? Ophthalmology, ENT, general surgery, and plastic surgery. Let me tell you, plastic surgery take another 3 years for a person to,
Dr. Agarwal, will it then be fair to say that your biggest concern is the time which has been expedited for these Ayurveda doctors? Because as you're pointing out...
No. My issue is saying that please don't encroach upon any other specialty. You make advancement in Ayurveda. I have no problem. Indian Medical Association has no problem. Ayurvedic doctors performing surgeries. And I mean, a proper surgeon can take 10 years. You cannot make a surgeon in 5 means whatsoever it has been happening in the past. You are just trying to legalize it. And that is what Indian Medical Association opposing it. We are opposing mixopathy. We are not opposing any specific pathy. We want their advancement. We want, we wish them good luck.
Okay, so as far as the IMA is concerned, they're saying that we do not want mixopathy as far as traditional and modern practice is concerned. They're saying there should be more advances in Ayurveda, but both the doctors should be kept separately simply because of the skill set that is required and also the time period that each doctor puts in. But of course, the Ayurvedic doctors feeling that they're equally well qualified to tackle modern surgery as well. Shifting focus then, as COVID cases surge, states, of course, are reimposing curbs in several cities across the country. The Delhi government, for example, has increased the penalty for not wearing masks in public from Rs 500, which was earlier, to Rs 2,000 now. In Maharashtra, the state government has allowed schools to reopen, but only for classes 9th through 12th. All of this happening from the 23rd of November. However, local administration in Mumbai, Navi Mumbai, Thane and Panvel have ordered all schools to remain shut till 31st of December, citing the possibility of a second wave. The state government is also planning to suspend flights and trains to and from Delhi because of the rising cases. Meanwhile, the Rajasthan government has also issued prohibitory orders under Section 144 in 33 districts, and the Uttar Pradesh government has also sounded the alarm and appealed to citizens to remain indoors. So, of course, more and more state governments, they're going back with some curbs which we had actually seen being done away with as cases start to rise. If you talk about the national capital, of course, we're seeing cases increase. Of course, the death rate continues to be a big concern for the national capital. Yesterday also we saw over 100 deaths back in the national capital. So the state government, even though the chief minister said that there will be no lockdown, whether partial or fully in the national capital, there are some other plans which are being put into place. For example, a penalty which has now been increased for mask violators from Rs 500 to now 2,000. Of course, additional medical infrastructure has also been put in the national capital to contain the numbers. Some other states, for Maharashtra, for example, they've allowed classes only for classes 9 to 12th. That also from the 23rd of November. The rest of the schools in the state will stay shut till the 31st of December. Nitisha now joining us on the phone line. Nitisha, of course, we're seeing more and more state governments going back to the curbs that had been done away when the state started to unlock all of this because of, the rising cases. Let's talk about the national capital. Of course, worrying situation on the national capital, not just with the number of cases, but the death rate, which still continues to be over 100 deaths in 24 hours.
Well, yes, Ridhima, in fact, that is a worrying trend that we are seeing in the national capital, and because of which only a notification has been issued that, those who are not following the norms, social distancing norms, or not wearing masks at the public places, they should be fined Rs 2,000 instead of Rs 500, which was earlier. In fact, after this increased fine, we have seen 46% of less cases of people not wearing masks at the public place. In fact, if you go by the data that the Delhi police have issued, around 1,300 people have been challened for not wearing masks at public place, which was around 2,400 a day before, when Rs 2,000 fine was not announced.
Yeah, so we're actually seeing some sort of yielding results in terms of this mask violation, which has now been increased by the state government. Nitisha, thanks for getting us all those details. But some breaking news now coming in. We're understanding that the central team has been rushed to the state of Gujarat to meet CM Vijay Rupani at 4 p.m. today at his official residence in Gandhinagar. That's the update that we're understanding. High-level teams, of course, have been deployed. Central team rushed to the state of Gujarat. We're understanding the CM will meet this team, which has been sent by the central government, at 4 p.m. later this evening. Of course, we'll be talking about the containing of the pandemic. Remember, the centre has been rushing teams to various states, Himachal Pradesh, Punjab as well, and now we're understanding that one such team has been sent to the state of Gujarat as well. We're understanding this central team will meet the Chief Minister Vijay Rupani at around 4 p.m. This evening. So, of course, the centre stepping into aggressive action, deploying extra hands, extra teams, sending them off to the states to contain numbers, especially to the smaller states as well, where, of course, the recovery rate and the death rate continues to be a big concern. Well, let's talk about some of the stories. Then active cases in India are on a rise again with over 45,000 new cases. India's total tally nears the 91 lakh mark. The number of new cases reported today have spiked by a little over 1,200 compared to the previous day. India recorded 501 new deaths in the last 24 hours. However, due to high recovery rates, India now stands at number 7 in the world in terms of total active cases. Troops of 205 Cobra along with Bihar police gunned down 3 Maoists during a gunfight at the Barchati forest area of Gaya district. One AK-47 rifle and an incest rifle were recovered from the spot. A police personnel was injured in the gunfight. He's now been admitted to a hospital. Prime Minister Narendra Modi virtually laid the foundation stone for drinking water supply projects in Mirzapur as well as Sonbhadra districts of Uttar Pradesh. UP Chief Minister Yogi Adityanath was also present at the ceremony. The Prime Minister promised that the project will help more than 3,000 villages.
जल जीवन मिशन के तहत घर घर पाइप से पानी पहुंचाने की वजह से हमारी माताओं बहनों का जीवन आसान हो रहा है। इसका एक बड़ा लाभ गरीब परिवारों के स्वास्थ्य को भी हुआ है।
And around 80 cows were found dead at a cow shelter in Rajasthan's Churu district. The cause of this mass death is still unknown. Matter is being investigated to ascertain if deaths were due to food poisoning, any disease or other reason. After frequent ceasefire violations across the LOC, a Pakistani drone was spotted at the Mendar sector of Poonch in Jammu and Kashmir last night. Following the drone, Pakistan violated the ceasefire once again today morning at the Nowshera sector of Rajouri. Now, a day after the Prathagarh accident, a bus on its way overturned near the Siddapur village in Unnao last night. The bus was carrying 82 passengers from the national capital, while 20 passengers reported to be injured. Operations are underway to rescue the rest of the passengers. The second edition of the trilateral maritime exercise between the navies of India, Singapore and Thailand commenced in the Andaman Sea. Indian Navy ships including the SW Corvette as well as the missile corvette Karmuk are participating in the second edition of this exercise. And there is a World Toilet College in Aurangabad in Maharashtra. It was started by the Reckitt Benckiser in 2018 in association with Jagran and the World Toilet Organization to train as well as to rehabilitate manual scavengers. Yes, many of you are hearing about this probably for the first time, just like Vijay who went to study there. Let's take a look.
मेरा नाम विजय टाक है। मैं वहाँ पर पहली बार गया तो मुझे ऐसा लगा देख के, अरे वर्ल्ड टॉयलेट कॉलेज बोले तो कॉलेज ऐसा पहली बार सुनने में अजब-व-गरीब लगा। टॉयलेट कॉलेज ये ऐसा लगने तो ऐसा भी होता है क्या टॉयलेट कॉलेज है। तो वहाँ पे जाने के बाद देखा तो सब अच्छा लगा और एक मन में वो हुआ कि नहीं यहाँ मुझे ट्रेनिंग लेनी चाहिए। कोई काम करना है तो वहाँ पे जाके हम डायरेक्ट काम करते थे, तो सेफ्टी किट यूज़ नहीं करते थे। वहाँ जाने के बाद पता चला कि हमें हैंड ग्लोव्स पहनने चाहिए। समझो सीवर में उतरना है तो एक जैकेट था, वो सेफ्टी किट का जैकेट वो दिया गया, गम बूट दिए गए। फिर वो पहनने के बाद सीवर में उतरा तो कुछ भी वो नहीं हुआ मैं, तो उससे और अपनी गंदगी से और अपना संपर्क नहीं हुआ। तो इसे वो उतारने के बाद सिर्फ उसे वॉश कर लिया और उसे सैनिटाइज़र कर लिया तो एकदम क्लीन। मुझे भी कुछ उससे वो नहीं हुआ, नहीं तो ऐसा लगता था जब खाना खाने बैठते तो याद आती थी तो खाना खाने को मन नहीं करता था।
What we actually did in the World Toilet College was brought them in, and over a 5-day period we were able to train them on several things. Train them on hygiene, train them on how to make sure that sanitation is done the right way, make them understand what their rights are basically as Indian citizens. So at the end of this, we were able to kind of place them with some really benevolent companies in housekeeping jobs, in cleaning jobs, in hospitals, in hotels and so on and so forth. And I'm really happy that till the end of 2019, very early 2020, before COVID started, we had trained and rehabilitated and placed in jobs 5,000 plus manual scavengers in Aurangabad, Bombay and Pune.
And before we wrap, attention for all our Tata Sky viewers, your favorite channel will be available on channel number 608 on Tata Sky from November 24.